Good evening, Mom. I am Hanafi Tolentino from DSNQF, and today I am going to perform our return demonstration on changing wound dressing. Now, before I start, I will perform hand hygiene first. Next, I will gather all the materials needed in changing wound dressing, and I will provide my patient the privacy. Hi, Mom. I am Nurse Hanafi. May I know your name, Mom? Kaisaan Sibiyaw. Ma'am Kaisaan, when is your birthday? July 30, 1999. Okay. Ma'am Kaisa, I'm going to change your wound dressing. But first, I'm going to clean it. This will promote healing on your wound, Mom, and also prevent you from complications. If you're going to rate the pain in your wound, Mom, 0 as none and 10 as the highest, how are you going to rate it? 7. 7. Okay, now I am going to place my patient comfortably and I will expose the area needed, which is the operative site. So this is the operative site of my patient, which she has undergone through surgery, which is open cholecystectomy. Now I am going to place the disposable biohazard bag within my reach and also ask permission first. So, Mom, is it okay for you if I'm going to put the biohazard bag in your lap? Yes. Okay, Mom. So make a cup. Then put it within your reach, which is the patient's lap. Now I am going to put clean gloves. Now after putting clean gloves, I am now going to take off the wound dressing and I will remove the tape by pulling it parallel to the skin while holding the uninjured skin. Now fold it and discard. Then remove also the inner dressing. Now peel off the clean gloves inside out and perform hand hygiene. Then I will apply another clean gloves to assess the wound. Now I'm going to assess the wound of my patient. So after assessing the wound of my patient, I'm going to remove the gloves and put it in the biohazard bag. Now I'm going to perform hand hygiene again. And I will put on another set of clean gloves. After putting clean gloves, I am now going to prepare for the sterile field. So assuming that this is a sterile drape. Now I am going to put plain NSS in the container where I'm going to dip the cotton balls. And also, I am going to use a forceps in holding the cotton balls. Because I am using a clean gloves, I will use a forceps to avoid getting the cotton balls unsterile. So dip the cotton balls in the solution. Then what I'm going to do is wipe the wound in one swipe only. Swipe, one swipe, then discard. Discard the cotton balls. Next is I am going to pat dry. Then discard. Now I am going to apply the inner dressing. Apply additional gauze as needed. It should cover all the wound. So I am also going to use a forceps because I am not using a sterile glove. Next is apply the outer dressing. Apply a thicker woven pad such as serge pad or abdominal dressing. Then secure the dressing with a plaster. Make sure that the plaster is not parallel to the patient, but in my case, I'm going to put plaster in four sides of the woven pad. So after securing my patient's those pads, I am now going to put a label with my initials and the date and also the time, and this is according to the hospital protocol. Now I'm going to discard my gloves and put it in the biohazard bag. Perform hand hygiene. Then put another set of clean gloves. Now I am going to dispose all the materials used. Then after that, I will remove my gloves and also dispose it. Perform hand hygiene. And I am now going to put my patient in a comfortable position. Now we're done, Ma'am Kaisa. So Ma'am Kaisa, if you are going to rate the pain in your wound from 0 as none and 10 as the highest, how are you going to rate it? 5. 5. Okay, Ma'am Kaisa, I will be back in a bit to check on you. Please let me know if you need anything. Okay. So before leaving the patient's room, perform hand hygiene. And lastly, document the procedure and the assessment of the patient.